I'm joined by Sharon Ekambaram, head of the Refugees and Migrants Rights Program at Lawyers for Human Rights. Sharon, thanks for your time today. Operation Dudula and other groups who block patients, it's obviously illegal to do that. Who should take responsibility?
What we are witnessing is a collusion by law enforcement, immigration officers and the South African police services who stand by and don't ensure that our laws and policies are respected. So what Operation Dudula is doing is a criminal offence to block even emergency entrance to a place like Addington Hospital in KZN. That's what we are witnessing. And the police should be asking them to move away because they're gathering outside a public health institution. But I think the responsibility lies with management of public health facilities, hospitals, clinics, should ensure that no one is blocked from entering their facilities. And we see that this is not being done. And we're having, individuals from Operation Dudula just randomly asking anyone to show them their ID, and that's definitely unlawful. Very reminiscent of the Dompass system under apartheid. If you didn't have an identity document, you were refused, and we know that there are probably about 700,000 people at the moment, South Africans, who don't have an ID, who've had their IDs blocked or who are struggling to get IDs.
Why is it so difficult to get documents in South Africa?
A contributing factor is institutionalized xenophobia, where it's assumed that any foreign national coming from the African continent is lying about their reasons for coming to the country. So you're having people coming from the DRC, from Somalia, even people coming from Gaza who cannot access the asylum system. And so they remain undocumented and at risk of being arrested and have no legal documents to be in the country. With respect to people coming from the neighboring countries, I think in particular in Zimbabwe, it costs about $250 to get a passport.
You have taken people like the Premier of Limpopo, Poppy Ramathuba, to the Health Professions Council when she, about 2 to 3 years ago, spoke very harshly to a Zimbabwean woman patient, and that was circulated on social media.
You speak Shona, and then how do you find yourself in Villa and Malala when you are supposed to be with Munangago there? You know he doesn't give me money to operate you guys. Killing my health system. Instead of using the budget for what it's meant for, I'm operating for what Munangagwa is supposed to do. So, says you won't be discharged until you settle your bill. You must charge him.
What progress are you making with that case, and how important is it to do that?
It is very important. She is first and foremost a medical doctor, and she has taken a Hippocratic oath about how she will conduct herself as a medical doctor. The Health Professions Council found that her behavior contravened how she should be behaving as a medical doctor. There has been a disciplinary hearing because she challenged that finding, and it has been going on for 2 or 3 years. It's at huge cost, obviously, to the taxpayer, because every time there's a hearing, there's lots of costs involved. But there is, at the end of the day, I'm hoping that justice will be served. It's still ongoing.
Now, leaders like that, and other leaders too, who have xenophobic sentiments, that filters down to healthcare services on the ground.
We have the minister, Aaron Motsoaledi, making unsubstantiated statements that our public facilities are flooded by migrants. Now, if you do the maths, there's about 3 million foreign nationals in our country, international foreign nationals from the African continent predominantly. And we have a population of 65 million people from the last census. So it's not plausible to have that tiny percentage flood public hospitals. And I think that in scapegoating the migrants, then our attention is detracted from the corruption and mismanagement that is taking place, in particular in the Department of Health. There is enough evidence around corruption in our country that is the real cause of the crisis of service delivery, the crisis of unemployment, and the crisis of quality healthcare in public health institutions.
Sharon Ekambaram, thanks very much for your time today.
Thank you.